हेलो हेलो हेलो, हाँ अभी सही हो गया आई गेस। अभी सही हो गया ना? अभी अभी आ रही है। नागेश, ईशा, विपिन, भास्कर, निको, पूजा, तास्मीना, जोया, वानी, जोया विद एन एक्स। आई थिंक अभी क्लियर हो गया। अभी सही हो गया I guess। अभी सही हो गया ना? अभी हाँ, मुझे अपनी आवाज़ आ रही है। ओके ग्रेट, चलो। तो टॉप 10 ड्रग्स क्या क्या हैं, कौन कौन से ऐसे ड्रग्स हैं जिनको एग्जामिनर इतना पसंद करता है कि एटलीस्ट आपको जानना ही चाहिए वो ड्रग्स के बारे में। और जो जो बातें बता रहा हूँ, चूंकि ये बहुत ही शॉर्ट सेशन है, 25 to 30 मिनट का सेशन है, लेकिन इसमें जो बातें बता रहा हूँ हमेशा से आए हैं और उम्मीद करते हैं कि अपकमिंग एग्जामिनेशन में, आपके एग्जामिनेशन में कहीं ना कहीं ये भी दिख जाए। ठीक है, तो एक एक करके स्टार्ट करते हैं। सबसे पहले ड्रग मैंने अल्फ़ाबेटिकल ऑर्डर में अरेंज कर दी हैं जो भी इंपॉर्टेंट ड्रग्स हैं। तो it will be discussed in alphabetical order for all my non Hindi speaking students. Sorry about that. Let's get started. The first drug that I'm going to discuss for all of you guys is going to be amiodarone. What you guys know already amiodarone के बारे में, about amiodarone what you know already, that this is one of the class 3 anti-arrhythmic drug. Yes or no? It is one of the class 3 anti-arrhythmic drug. Quickly, as I told you that this is going to be a 30-minute session, right? So if I am going to spend 3 minutes also on one drug, then also it will take around 30 minutes. So 10 into 3, 30. But you guys know me if you have attended my class, ki I am always, little bit over enthusiastic. Ki, I give some more details, some more data, some more data. I try to always summarize more data as much as possible, squeeze more information as much as possible in a single question, right? Zoyavani, tomorrow session for FMG, definitely it is important for NEET PG as well. So NEET PG FMG सारे बच्चे कल भी ज्वाइन करेंगे, कल 11 बजे से जो आपका सेशन है। ठीक है, चलिए। क्लास 3 एंटी एरिथमिक ड्रग, दिस इज गोइंग टू बी mainly a potassium channel blocker. It's mainly going to be a potassium channel blocker. What all things that you should know, that this is one of the broad spectrum anti-arrhythmic drug. That means they are having all the properties: sodium, beta, potassium, calcium, but the predominant action is seen at the potassium, and that is why they have been classified under class 3 anti-arrhythmic drug. Predominant action किस में है? At the potassium. That is why they have been classified under class 3. They are actually, अगर if you are going to give them by oral route, orally they have slow onset of action, but the duration of action is long. That is why in emergency condition we always try to give them via parenteral route. We always try to give them via the parenteral route, especially in a condition like ventricular tachycardia. And at present, it is the drug of choice in most of the ventricular arrhythmia, also in the resistant arrhythmias. If there is a ventricular arrhythmia, ventricular tachycardia in MI patient also, they are going to be the preferred one, right? They are also going to be the preferred agent in the ventricular tachycardia. We can also use them in other conditions as well, like atrial fibrillation में भी हम इसको utilize कर सकते हैं. But do remember, this class 3 anti-arrhythmic drug, it is mainly in emergency, we try to give them via the parenteral route. If you're going to look at the T half-life, the T half-life on an average is around 53 days, but the range has been given 25 to 103 days. Okay. So in emergency, we always try to give them via parenteral, but orally we do not give them in emergency. Because why am I focusing on this point? Because this was one of the question, that oral this, parenteral this, oral this, parenteral this, right? So orally we don't prefer them in emergency. Now amiodarone as a drug, look at the name, amiodarone. The name itself contain iodine. Amiodarone, the name itself contain iodine. Now you see, iodine is consumed in the food, and also iodine you are taking in the drug also. And because of this reason, remember, because of this, there is increased risk of hyperthyroidism. Thyroid hormone synthesis will be increased, leading to hyperthyroidism. The story doesn't end there. They are always going to play with the emotion of the thyroid. One way they are causing hyperthyroidism. At the same time, I'm telling you, they also have inhibiting property, peripheral T4 to T3 conversion inhibiting property, and that can lead to hypothyroidism. Now you see, they are going to keep the thyroid always in the confused state. And what I always say, that they are always like that girlfriend जो कि ना हाँ बोलती है ना बोलती है. Neither she says yes nor she says no, and she is always keeping hype और hype, मतलब बीच में हमेशा लटका के रखने वाला सिचुएशन है. तो sometime हाँ sometime ना, सेम सिचुएशन हियर ऑल्सो. थायराइड इज ऑलवेज कंफ्यूज्ड, भाई चाहते क्या हो बता दो एक बार, है ना. सो द पेशेंट मे प्रेजेंट विथ हाइपर, may present with hypo, right? Do remember this one. Apart from that, one more question that can be asked for all of you guys, is with respect to their action potential duration. You see, they are the potassium channel blocker, and I'm sure all my students are already aware about action potential duration. One action potential duration, for example, phase 0, the causes of the different phases, no, phase 0, phase 1, phase 2, phase 3, phase 4. Phase 3 ka main cause is mainly due to the potassium efflux, mainly due to the potassium efflux. Now, what is going to happen if you are going to give your patient one of the potassium channel blocker? Listen to me carefully. I said potassium channel blocker, it will not affect the slope of depolarization. That means the slope of depolarization will be as it is. I repeat, the slope of depolarization is going to be as it is, but what is going to change mainly is the slope of repolarization, and it is going to take more time for the repolarization, and that explains the fact that why this group of drug is going to be associated with the fact like QT prolongation. So QT prolongation इनके साथ एक हमेशा problematic side effect रहेगा. So they can increase the action potential duration, and if you correlate this action potential duration on the ECG, that will be corresponding to the QT interval. So QT interval को prolong करते हैं ये. Do remember that, right? हाँ, अगर कोई भी ड्रग QT प्रोलोंगेशन के रिस्क को बढ़ाता है तो दे विल आल्सो इंक्रीज द एरिथमिक कंडीशन लाइक टोर्साइटिस डिपॉइंटिस, राइट? सो अगेन ये मैंने जो अब चूंकि ये हमें आधे घंटे में इतनी सारी चीजें करनी है, ये क्विक समरी मैं बता रहा हूँ एमियोड्रोन के बारे में जो आपको आनी चाहिए. थायराइड का रिलेटेड साइड इफेक्ट, इनके डिफरेंट मैकेनिज्म ऑफ एक्शन, पेरेंटल रूट्स हम देते हैं इमरजेंसी में, ग्राफ इसका कैसा दिखेगा, साइड इफेक्ट इफ यू आर गोइंग टू लुक एट दिस. Amiodarone, I always say that look at the name, and the name will have everything. Amiodarone. So this itself is saying drone. You see, you're studying right now at 9:30 and a drone is going to fly near your window or inside the room that you're studying. You might get scared that, okay, drone se kisne attack kar diya. So you will say, quite, shh, let's panic. Quite, let's panic. Simple way to remember all the important drone wale side effect, amiodarone wale side effect. QT prolongation that I told you already, because of the potassium channel blockade, they are hepatotoxic drug. एमएसिस मतलब vomiting होता है. Thyroid abnormality, that become the most common side effect, right? That become the most common side effect. Photosensitivity, because of this the sun exposed part will turn out to be grayish blue. Because of the grayish blue or bluish gray, we are going to call them, or they are usually called as blue man syndrome. So blue man syndrome is caused by this drug. Do remember that. Abnormal endocrine function, in some cases, not very commonly, but in some cases they are associated with gynecomastia. Plus, do remember this, thyroid abnormality तो हाई है, thyroid abnormality तो हाई है, ठीक है. Optic neuritis is also a rare kind of side effect. Then we also have interstitial lung disease leading to pulmonary fibrosis and corneal microdeposit, that is called vortex keratopathy या cornea verticillata. Right, so do remember this. Quite, let's panic, एक बार quickly देख लीजिए amiodarone का side effect and you will never forget, है ना. Quite, QT prolongation, let's panic, liver toxicity, MSC, thyroid abnormality, let's panic will be photosensitivity, abnormal endocrine function, optic neuritis, interstitial lung disease, corneal microdeposits. Last but not the least is which of the following investigation will be asked on the follow-up. So if there is a patient on amiodarone therapy, what is the investigation will you ask? So I always say that if you know the side effect, you will be able to know the what all investigation you should ask. So examiner question पूछा, all the investigation are necessary except or least important investigation in if there is a patient on amiodarone therapy. So see, you should always keep an eye on the ECG, because QT prolongation is a side effect. LFT, ECG, TSH या thyroid function test. So I always say let's do this one, है ना, let's do this one. एक और होता है spirometry. Spirometry is mainly the pulmonary function test also, या HRCT कर लीजिए. HRCT is the investigation of choice for interstitial lung disease. So let's do this one. Let's do this one. So this is a quick summary about amiodarone. I hope कि amiodarone को आप कभी नहीं भूलेंगे. amiodarone से related जितनी भी बातें important बातें थी एक बार quickly हमने cover कर लिया. amiodarone. Next drug आप सभी के लिए है, that is going to be atropine. Again, as I told you that I have brought it via इसको alphabetical order में. atropine है क्या? What is atropine? Remember, boys and girls, atropine happens to be a non-selective muscarinic antagonist. It is one of the non-selective muscarinic antagonist. That means they are going to have M2 का blockade action more commonly as compared to M1 and M3 blockade action. right? So all of them will be blocked. M1, M2, M3, everything is going to be on the top. Very good, Dr. Zoya Wani. Okay, M2, M1, M3. That means all of them will be blocked. Now you see, M1, M2, M3, all of them are blocked. That means anticholinergic drug hai. It is going to be an anticholinergic drug. Because of blockade of M2, what will happen? The heart rate is going to increase. M2 is mainly present on the nodal tissue of the heart. M1 is mainly present at GI and CNS, so they will lead to decrease in the GI secretion. And M3 is present on the rest of the area, like let's say eyes. So they will be leading to mydriasis, decrease in the secretion. Because of that, the body temperature is also going to increase. The body temperature is going to be increased. So what I say that don't call atropine as atropine. Atropine को बुरा लग जाता है. Atropine को आज से हम atropine नहीं बोलेंगे. We are going to call atropine as atopine, because in atropine toxicity, atropine overdose, everything will be on the top. Everything will be on the top. का मतलब क्या हुआ? What are things are going to be on the top? You see, pupil size on the top, body temperature on the top, heart rate on the top. And you always start from the eyes, because whenever we discuss the poisoning, what I say that eyes never lies. आंखें कभी झूठ नहीं बोलती हैं. Eyes never lies, right? Pupil size, आंखें बड़ी बड़ी, heart rate बड़ा बड़ा, body temperature बड़ा बड़ा. तो that will be most likely overdose of atropine, right? So atropine के एक बहुत common side effect भी है, जिसको हम बोलते हैं usually atropine fever. So examiner asks that a patient presenting with the poisoning of organophosphate, he was started on atropine. Now the body temperature is increased. What is the cause of this body temperature? So multiple reason has been given in the option, and one of the options says it is the common side effect of atropine, and that was the correct one. बहुत पुरानी बात नहीं है, 2023 की बात है जो मैं आपको बोल रहा हूँ, right? So atropine is going to be atopine. Now where do we use atropine? There are a lot of uses of atropine actually. Atropine, we can use them in physostigmine poisoning, organophosphate, or carbamate poisoning. In sinus bradycardia, sick sinus syndrome या heart block, इन सभी में they are not only used, rather these are considered as a drug of choice. Heart block, morbid complete or partial heart block, vasovagal shock में भी also these are the drug of choice. In acute iridocyclitis, for the pain relief, we always use atropine, because they will be causing cycloplegia, ciliary muscle paralysis. Cycloplegia causing ciliary muscle paralysis. They are also going to be added along with your opioids. They are going to be added along with the opioids. So opioid, like let's say, they are going to be added along with the opioids like diphenolate. So इसको मैं बस opioid यहाँ लिख दे रहा हूँ. Opioids to treat the non-infective diarrhea. And also remember, when you add them with the opioid, they will decrease the risk of opioid abuse potential. Abuse potential को कम करते हैं. There are two reasons why and how they are going to decrease the abuse potential. Reason number one, atropine का side effect will be more predominant, and second thing, in presence of atropine, the dose of opioid that is required will be lesser. The dose of atropine that will be required is going to be lesser, right? They have been used in the past as a pre-anesthetic medication as well, but because of the post-op psychosis risk that was very high, we do not use them anymore. We do not use them. Post-op psychosis is risk is going to be high, so that is why we do not use them anymore. Do remember that. So multiple condition में we are using atropine. Atropine is a non-selective muscarinic antagonist. Sinus bradycardia, heart block, everywhere it is going to be the drug of choice. And when we use them, also in a pediatric population 0 to 7 year, they are the preferred mydriatic and cycloplegic agent. Preferred mydriatic and cycloplegic is going to be 1% atropine ointment. Ointment form में देंगे, not the eye drop form, because eye drop will have high risk of systemic absorption, and that is going to lead to atropine fever, right? So do remember this. These are the different uses of atropine. Apart from that, remember atropine का important side effect क्या होगा? What will be the side effect? So you see the side effect is again, as I told you, everything will be reduced. So everything will be on the top. So you can say the heart rate is going to be on the high side. There will be mydriasis, and because of the mydriasis, there is going to be blurring of vision. Blurring of vision. They can also lead to urine retention because they are anticholinergic in nature. They are also going to lead to increase the body temperature. So this information I have told you already. So that give us the next question, which was another question that was asked in 2022. What are the contraindication of atropine or hyoscine? Because atropine, hyoscine, they both are anticholinergic drug. So I say they are not going to be given in angle closure glaucoma because they themselves are causing mydriasis. You know the rule, if a drug is causing miosis, it can be used in glaucoma. If it is causing mydriasis, it can always precipitate glaucoma. Because if they cause mydriasis, they will always interfere with the aqueous outflow. BPH में नहीं देंगे because they themselves are causing urine retention. BPH मतलब benign prostatic hypertrophy. And if there is a known case of urine retention, you should not be giving them. And also you should avoid as much as you can systemic route say in the child. In the child also we should not be giving them, especially in the via the systemic route. At any point of time, if there is atropine ka toxicity, we use physostigmine. The datura is also one of the fruit या plant product जिसका एक्टिव कंपोनेंट इज आल्सो एट्रोपिन, और उसका भी टॉक्सिसिटी में वी ट्राई टू गिव अ physostigmine. तो वन ऑफ द क्वेश्चन दे आस्क, a person ate the fruit of a plant and now he is having all the symptoms. So symptom is going to be same for the datura also. The symptom is going to be same. Everything is going to be on the top. What is the antidote? So the antidote is going to be your physostigmine. Either datura ho ya your atropine हो, the antidote is going to be same, that is physostigmine. और physostigmine की toxicity में हम atropine दे सकते हैं, right? So this was your second drug, that is going to be your atropine. Atropine like drug, in one of the question examiner asked atropine like drugs in the eye. So look at this, atropine like drugs. So atropine is an anticholinergic drug, atropine like drug in the eye. So I always say eyes, जब anticholinergic drug आंखों की बात आए तो उनके आंखों में देखिए जिनकी आंखें बड़ी खूबसूरत हैं. किनकी आंखें बड़ी खूबसूरत हैं? इन बॉलीवुड देयर इज अ वेरी फेमस एक्ट्रेस. In Bollywood, there is a very famous actress who is, who is having very pretty eyes, right? Who is that actress who is having very pretty eyes? है ना? आजकल काफी चर्चा में भी हैं. I think each one of you are already aware. Aishwarya. If you want to know the beauty of her eye, let's do a CT scan. ऐश्वर्या के आंखों की CT. किसकी CT? ऐश्वर्या के आंखों की CT. Atropine, scopolamine, homatropine, cyclopentolate, tropicamide, and this has been given on the basis of the T half-life. Like atropine ointment 7 to 10 days, some textbook it say up to 2 weeks also. Scopolamine 3 to 7 days, homatropine 1 to 3 days, cyclopentolate 6 to 18, and tropicamide 6 to 8 hours. The preferred mydriatic cycloplegic in adult is going to be tropicamide. Preferred. If tropicamide is not in the option, you can even go for cyclopentolate. But in pediatric, the ciliary muscle tone is very strong, so we require a very potent, more stronger anticholinergic drug, and that agent is called your atropine, right? So do you remember atropine is stronger है, लेकिन फिर भी हम adult में नहीं दे रहे हैं, बच्चों में दे रहे हैं, because बच्चों का in pediatrics the ciliary muscle tone is relatively very stronger, right? So ऐश्वर्या के आंखों की CT, that is going to be atropine like drugs in the eye, right? HIV pregnant women and after childbirth, definitely Anna, I will definitely summarize. If you can wait for just 15-20 minutes, I will definitely summarize. Let me just finish this one and then we can definitely summarize, because जो हमारा main target है पहले उसको कर लें and then we will be coming up with that. ठीक है? तो मैं जैसे कि मैंने बोला कि आधे घंटे का सेशन है और ऑलरेडी आई थिंक 15 मिनट हो ही गया, तो 15 मिनट और है, 15-20 मिनट्स रुक जाइए एंड देन इमीडिएटली आई विल टेक ऑल द क्वेरीज. ठीक है, चलो अगले क्वेरी की, अगले ड्रग की बात करें, ब्लियोमाइसिन. Bleomycin, remember, it is one of the anti-cancer drug. Bleomycin is one of the anti-cancer drug. It is coming as a G2 phase specific anti-cancer drug, and is also having anti-tumor antibiotics activity. Anti-tumor antibiotic activity. Anti-tumor antibiotic. They mainly are going to act by free radical generation. Free radical generation, mainly are going to act by free radical generation, right? Bleomycin, remember it's an anti-cancer drug. Look at the name, bleomycin, blue, right? Bleomycin. Now, where do we use bleomycin? It's an anti-cancer drug, anti-tumor antibiotic, G2 phase specific. Where can we use bleomycin? Who can tell me where can we use bleomycin? Who can tell me where can we use bleomycin? See, many conditions में we can use. For example, testicular carcinoma. जब भी टेम्परेचर चेंज होता है, टेस्टिकल्स आर द फर्स्ट वन टू सेंस द चेंज इन टेम्परेचर एंड टेस्टिकल स्टार्ट टू से बीप 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 बीप. टेस्टिकल बीप करता है, तो आपको याद रखना है कि देयर इज गोइंग टू बी बीप रेजिमेन. बीप रेजिमेन स्टैंड फॉर योर bleomycin, E for etoposide, bleomycin, etoposide, and P for platinum compound. Although the drug of choice for testicular carcinoma is going to be platinum compound like cisplatin, but we can utilize this agent as well, right? Then we can also use them in Hodgkin's lymphoma, non-Hodgkin's lymphoma, and Hodgkin lymphoma, non-Hodgkin lymphoma. मतलब bleomycin का एक तरह से देखा जाए तो it's a broad spectrum drug, broad spectrum agent. Bleomycin as an agent, listen to me the next 2 minutes very carefully. Bleomycin as an agent is mainly going to get metabolized in the liver and spleen, right? In the liver and spleen by an enzyme that is called hydrolase enzyme. The name of the enzyme is called your hydrolase enzyme. This hydrolase enzyme is mainly present in which all organ? In the liver and in the spleen. Hydrolase as an enzyme, the enzyme is actually less present in the lungs, and that explains the fact that why these agents are going to get deposited in the lung, and they are going to be associated with something called your pulmonary fibrosis. They'll be causing pulmonary fibrosis. And do remember this, to slow down this pulmonary fibrosis, we have an agent that is called your nintedanib, जो कि 2024 INI का क्वेश्चन है. nintedanib और perfenidone. So they are going to slow down the pulmonary fibrosis. They will slow down the pulmonary fibrosis का progression of pulmonary fibrosis will be slowed down. So this enzyme is going to be less present in the your lungs, but this enzyme is actually going to be absent in the skin, and because they're absent in the skin, they get deposited in the skin. There will be too much deposition in the skin, and because of the too much deposition in the skin, they lead to a very famous condition that is called your flagellate dermatitis. So skin will turn out to be grayish blue. ग्रेश ब्लू का मतलब आपको देखिए, लुक एट द नेम, नाम को ध्यान से पढ़िए तो ब्लियोमाइसिन नाम है ये, ब्लियोमाइसिन. तो ग्रेश ब्लू स्किन, राइट, या ब्लूइश ग्रे, ग्रेश ब्लू स्किन, राइट. सो ग्रेश ब्लू डिपोजिशन हो जाएगा, इसको हम बोलते हैं फ्लैजेलेट डर्मेटाइटिस. सो एग्जामिनर क्वेश्चन पूछा विच टाइप ऑफ एंटी कैंसर ड्रग कैन कॉज दिस वन, सो दिस विल बी कॉज्ड बाय योर bleomycin, right? Are you guys following me here? This information that I'm giving you is from Goodman-Gilman, very important. The important side effect therefore is going to be pulmonary fibrosis. Important side effect is going to be flagellate dermatitis. In addition to that, remember, these are having all other side effects like nausea, vomiting and all. But what is one thing that you should know, which I'm going to put in the red ink, is called that they are considered as the marrow sparing anti-cancer drug. This is very important. Marrow sparing anti-cancer drug is going to be bleomycin. मैरो स्पेयरिंग एंटी कैंसर ड्रग, मतलब अगर किसी के काउंट्स बहुत कम हैं और आपको कोई एंटी कैंसर ड्रग प्रिफर करना है, स्टार्ट करना है, तो दिस विल बी वन ऑफ द ऑप्शन, मैरो स्पेयरिंग एंटी कैंसर ड्रग. बिकॉज दिस इज अ रिव्यू सेशन, एक चीज से दूसरी चीज निकल के आती है. देखिए, ये बात पे यकीन करना बहुत मुश्किल है कि कोई भी एंटी कैंसर ड्रग बोन मैरो सप्रेशन नहीं कर रहा, बिकॉज ऑल द एंटी कैंसर ड्रग दे टारगेट रैपिडली डिवाइडिंग सेल्स. What did I say? I said all the anti-cancer drugs, they target rapidly dividing cell. Therefore, it is very difficult to believe that some drug is not causing bone marrow suppression. But है तो है. So still I say, believe me, these are marrow sparing anti cancer drug. मैंने क्या बोला? Learn pharma in my style and believe me, these are marrow sparing anti cancer drug that stand for bleomycin, L-asparaginase, bleomycin, L-asparaginase and vincristine. Believe me, these are marrow sparing anti cancer drug, है ना? Believe me, these are marrow sparing anti cancer drugs, है ना? तो डिफिकल्ट करना कितना मुश्किल है, इसीलिए तो मैं बोल रहा हूँ कि बिलीव मी, है ना, BLV, बिलीव मी, दीज आर मैरो स्पेयरिंग एंटी कैंसर ड्रग. ठीक है. सो अगेन एक चीज से दूसरी चीज निकलती है. अब आते हैं अगले ड्रग के बारे में. थर्ड ड्रग फॉर द डे इज गोइंग टू बी सिस्प्लाटिन. जैसे कि मैंने बोला शॉर्ट सेशन है और 10 दवाओं के बारे में जिससे बार बार क्वेश्चन आते हैं. पिछले एग्जामिनेशन में सबसे फ्रीक्वेंटली पूछे गए ड्रग्स यही हैं. सिस्प्लाटिन is also one of the anti-cancer drug. It is one of the anti-cancer compound. Cisplatin, one of the platinum compound, right? It's one of the platinum compound. Platinum compound. It is one of the agent that is having anti-cancer property. They act by mainly cross-linking of the DNA. Cross-linking of the DNA. And because of this, they lead to abnormal DNA formation. And this abnormal DNA that is formed, abnormal DNA is going to be caught at the cell checkpoint and that cell cycle will be arrested. The cell cycle is going to be arrested at that point itself, right? So cisplatin is one of the platinum compound. Now we have to quickly summarize cisplatin. इसके और भी भाई बहन हैं जैसे कि कार्बोप्लाटिन, ऑक्सैलिप्लाटिन. This cisplatin, it is going to be more nephrotoxic. Now this was one of the option of the question in January 2025, that whether cisplatin is more nephrotoxic or carboplatin. If any one of you have given January 2025 FMG, you know already they are more nephrotoxic than their other bhai bandhu, that is carboplatin, है ना, carboplatin. Then we have the third generation platinum compound. It is called oxaliplatin. This carboplatin is the second generation platinum compound. Oxaliplatin is the only compound in third generation. In fact, तीनों जनरेशन में एक एक ड्रग है. सिस्प्लाटिन इज द फर्स्ट जनरेशन, कार्बोप्लाटिन इज द सेकेंड जनरेशन एंड थर्ड जनरेशन इज गोइंग टू बी ऑक्सैलिप्लाटिन. ऑक्सैलिप्लाटिन इज शोइंग नो क्रॉस रेजिस्टेंस, नो क्रॉस रेजिस्टेंस with other platinum compound, no cross resistance with the other platinum compound. Cisplatin as a drug, if examiner is going to ask you where can we use cisplatin as a drug, remember cisplatin as a drug is going to be utilized in many conditions. Cisplatin as a drug is going to be utilized in many conditions, like for example they are drug of choice. ऊपर से नीचे की तरफ जाएंगे, they are drug of choice for head and neck cancer, drug of choice for head and neck cancer. Upper GI cancer. What is the meaning of upper GI cancer? Upper GI cancer means drug of choice for esophageal cancer, gastric cancer. Drug of choice also for cholangiocarcinoma. Cholangiocarcinoma के लिए drug of choice. It is also the drug of choice for urogenital carcinoma. Urogenital carcinoma. What is the meaning of urogenital carcinoma? The meaning of urogenital carcinoma is going to be bladder carcinoma, right? Then ovarian carcinoma, cervix carcinoma. In fact, this question has been asked in past 1.5 to 2 years, 3-4 times. What is the drug of choice for cervix carcinoma? As simple as it. Simple question आता है, right? Testicular carcinoma. In सभी में it's the drug of choice, right? Platinum compound, head and neck cancer, upper GI cancer, cholangiocarcinoma. In सभी में cisplatin being the drug of choice. Most commonly utilized agent among the platinum compound is going to be cisplatin, but they are more nephrotoxic. Remember that. And these are going to be a cell cycle non-specific drug. They are going to be cell cycle non-specific drug. All right. Now, important side effect, if I have to summarize quickly, the very important side effect. This is a line of the examination. What is the important side effect of cisplatin? They are going to be associated with the nephrotoxicity. Nephrotoxicity. This nephrotoxicity is more with the cisplatin as compared to carboplatin, oxaliplatin. So nephrotoxicity, सिस्प्लेटिन के साथ ज्यादा होगा एज कंपेयर टू कार्बोप्लेटिन. I am writing this once again. To prevent this nephrotoxic event, we have agents like your amifostine, right? We also can utilize N-acetylcysteine that is having nephroprotective property. But if the examiner is going to ask you most common side effect, remember it's nausea and vomiting. It is the maximum emetogenic. मतलब सबसे ज्यादा nausea vomiting अगर कोई करता है तो यही करता है. Maximum emetogenic anti-cancer drug is going to be this. It is also going to be a highly ototoxic drug. Ototoxic, peripheral neuropathy, bone marrow suppression, वो सब चलता रहेगा, है ना? Because they are causing ototoxicity, remember the risk is further increased with erythromycin, because erythromycin is also an ototoxic agent. Loop diuretics like furosemide और aminoglycosides. एरिथ्रोमाइसिन से रिस्क इसलिए नहीं बढ़ता है कि दे आर ऑटोटॉक्सिक बिकॉज एरिथ्रोमाइसिन इज एक्चुअली एन एंजाइम इनहिबिटर. फ्यूरोसमाइड इटसेल्फ इज एन ऑटोटॉक्सिक ड्रग एंड अमाइनोग्लाइकोसाइड इज आल्सो एन ऑटोटॉक्सिक ड्रग. तो इनके साथ रिस्क बढ़ जाता है. एंजाइम, दिस इज गोइंग टू बी एन एंजाइम इनहिबिटर, राइट? सो दीज आर गोइंग टू बी द इंपॉर्टेंट पॉइंट्स अबाउट द थर्ड ड्रग. द थर्ड क्या मतलब एक से कई, जैसे ए से दो ड्रग हो गए थे ना, तो वैसे करके वी आर प्रोसीडिंग. Now C से again this is a second drug that is going to be clonidine, and clonidine important, remember guys, it is one of the alpha 2 agonist. That means if you are going to look at the presynaptic neuron, this presynaptic neuron में alpha 2 receptor, once this alpha 2 receptor get stimulated, they are going to give us inhibitory signal to their own kind. That means the presynaptic neuron may, if there is noradrenaline release, noradrenaline stored, that will be inhibited. So alpha 2 agonists, they are going to act as a centrally acting sympatholytic drug. They are going to act as a centrally acting sympatholytic drug. Centrally acting sympatholytic. Although they are alpha 2 agonists, but look at the name. Although they are alpha 2 agonists, but these are sympatholytic drugs, centrally acting sympatholytic drug. Alpha 2 agonists like clonidine, and then there is one more called your alpha methyl dopa, clonidine or alpha methyl dopa. These are going to be your important alpha 2 agonist, है ना? They are going to inhibit the release of noradrenaline, inhibit the noradrenaline का release or secretion. Okay. क्लोनिडीन, इंपॉर्टेंट पॉइंट टू बी नोटेड अबाउट क्लोनिडीन. देखिए जो पुराने एग्जामिनर है ना, दीज ड्रग्स आर वेरी वेरी फेवरेट. दीज आर देयर पेट ड्रग बिकॉज दे हैव कंडक्टेड लॉट ऑफ रिसर्च, लॉट ऑफ थीसिस एंड लॉट ऑफ पेपर्स ऑन दीज ड्रग्स. सो दे ऑलवेज आस्क, द सीनियर एग्जामिनर्स ऑलवेज आस्क क्वेश्चन ऑन दिस. Important point about clonidine that you should know, that the different uses of clonidine are going to be hypertension, opioid withdrawal syndrome, Tourette syndrome में they are off level, that means not FDA approved but still being utilized. Diabetic diarrhea में these are considered the drug of choice. Pain management like neuropathic pain, postmenopausal hot flushes में we can use, and it's also an anti-smoking drug. तो I always say clonidine में एक word आता है clone, and learn pharma in my style. We want to clone, and why do we want to clone? Because we know कि when we clone we want the hot version of ourselves. So I say hot DPs, hypertension like hypertensive urgency, opioid withdrawal syndrome, Tourette syndrome, diabetic diarrhea may they are drug of choice. In diabetic diarrhea they are going to inhibit the bicarbonate secretion in the intestine. They are also going to increase the sodium and water ka reabsorption from the intestine. So the fluid content of the intestine, the bicarbonate content of the intestine is much lower. It's going to be much lower. Okay. So diabetic diarrhea, they are the drug of choice. The very important side effect of this one is going to be, a very common side effect is going to be a rebound hypertension, right? Rebound hypertension, dryness of mouth. In fact, in 2020 में INI का क्वेश्चन है, अभी INI का क्वेश्चन है कि a patient was on anti-hypertensive drug, he missed to take one drug, and now he is having confusion, he is having problems like constipation, है ना, and increased blood pressure, which anti-hypertensive drug he's taking, है ना. So rebound hypertension is very common side effect, and then it will also be causing low mood, impotency, dermatitis, sodium and water retention, and emesis. Remember, Dr. Clonidine is a very simple mnemonic. Remember the important side effect of Clonidine. ठीक है, जैसे कि ड्राइनेस, ड्राई माउथ, DR रिबाउंड हाइपरटेंशन. क्लोनिडीन को कैसे याद करोगे? CLO, C कॉन्स्टिपेशन, LO लो मूड, NI nasal stuffiness, impotency, DI dermatitis, increased sodium and water retention, and E for emesis, right? Yes, because in CVD patient they are actually going to be utilized, but ऐसा नहीं कि सिर्फ CVD में ही use करते हैं. We can use in other patients as well. In CVD patient we will use because of their double benefit. One is going to be their anti adrenergic action, तो वो हार्ट में sympathetic drive को भी कम करेगा. It is going to reduce the sympathetic drive to the heart as well. Remember, they are going to be a safe drug in pregnancy also. They are going to be a safe drug in pregnancy also. Okay. Next drug that I wanted to discuss for all of you guys is going to be doxycyclines. I hope see for दो दवाइयाँ हमने डिस्कस की. One is going to be clonidine. I think one is cisplatin, clonidine. दो दवाइयाँ हमने डिस्कस कर ली. Next it is going to be D for doxycycline. D से I think दो दवाइयाँ भी हैं. तो doxycycline. What is doxycycline? If I ask you very simple question. Doxycycline, it is cyclines. They are one of the tetracycline group of drug. Cycline नाम में आ गया. So this cycline as a drug, they are going to be 30S inhibitor. 30S inhibitor मतलब they are going to be protein synthesis inhibitor. This tetracycline, a protein synthesis inhibitor, they are mainly going to act by targeting amino acid tRNA. tRNA को inhibit करेगा at the A site of the 30S ribosomal subunit. So remember, tetracycline tRNA का inhibitor होता है. These are going to be bacteriostatic drug. Doxycycline as a drug, remember guys, these are also going to be very broad spectrum antibiotics. Tetracycline is going to be very, very broad spectrum antibiotics. So there are a lot of other tetracycline as well. Doxycycline is one of the tetracycline. They have a lot of uses. And what are the different uses? Doxylamine अलग है ना? Doxylamine is one of the antihistaminic drug having anticholinergic property. Do not be confused with the doxylamine. It is a drug of choice in a patient with the morning sickness. Doxylamine, it is going to be an antihistaminic drug with anticholinergic property. तो ये एक और ड्रग हो गया. Doxylamine, doxycycline are not two same thing. ठीक है. Now these are having good oral absorption, distribution is good, and they also cross blood placental barrier. So they have been associated with teeth staining and bone growth abnormality. So in pregnancy you should avoid, metabolize in liver but excreted renally. All the tetracycline are going to be excreted renally except doxycycline. And there is one more tigecycline. Tigecycline is one of the derivative of minocycline only. It's a derivative of conjugate of the minocycline only. So these are going to get excreted by the liver, and therefore these are considered as a safe in renal failure. So tetracycline, can I say they are also going to be safe in a renal failure? Patient. So an antibiotic preferred in renal failure, that will be doxycycline, or tetracycline, one of them. So they are having broad spectrum uses. So जितने भी rare infection आप जानते हैं, और I always say rare पहाड़ों वाले infection है ना, उन सब में यूज कर सकते हैं. Like Lyme disease, ureaplasma, urolithicum induced urethritis, cholera में we can utilize. Cholera में the best, if the examiner is always going to ask you, always remember oral rehydration solution, ORS या fluid is always best. ठीक है. Yersinia pestis causing plague, typhus fever, right? That is going to be your रिकेट्शिया इंड्यूस, रिकेट्शिया से एक और होता है रॉकी माउंटेन स्पॉटेड फीवर, इंग्विनाल ग्रेनुलोमा इंग्विनाल, सिटाकोसिस. So lucid trip is all the condition where it is not only used but also it's a drug of choice. It's not only used but it's also used as a drug of choice. Lyme disease, ureaplasma urealyticum, and a cholera Yersinia pestis. Typhus fever में in many places doxy or tetra is resistant. So in this one, in typhus fever, you know, sometime azithro is also added. Azithro is also added along with them. They are having other uses like meningococcal carrier state, acne, amoebiasis, peptic ulcer disease, है ना, और SIADS syndrome of inappropriate ADS secretion में भी हम इसको यूटिलाइज कर सकते हैं. There is a therapy that is called quadruple therapy. So quadruple therapy में we utilize tetracycline. In quadruple therapy, if you have read GI, you know already what I'm talking about, where we use tetracycline, metronidazole, and colloidal based on subsalicylate, and one of the PPI, proton pump inhibitor. So tetracycline, remember, is going to be utilized in all these conditions. Atypical pneumonia में mainly we use azithromycin. Okay. Now D से एक और ड्रग है diazepam. तो diazepam, remember, is one of the drug that is considered as a GABAergic drug. It is one of the GABAergic drug. इसको हम बोलते हैं mainly GABA facilitator. GABA facilitator, diazepam, and it's one of the benzodiazepine group of drug. And diazepam, benzodiazepine group of drug. And benzodiazepine, they are going to act at the GABA mediated chloride channel. Where do they act? They are actually going to act at the GABA mediated chloride channel. GABA mediated chloride channel, which is a type of ion channel, and these are going to increase the frequency of ion channel opening. Which ion channel? That is going to be GABA mediated chloride channel. Frequency of ion channel opening को ये बढ़ा देते हैं. At the GABA mediated chloride channel, they are going to act at benzodiazepine act at alpha and gamma subunit. Now this GABA mediated chloride channel is a pentameric structure. This is going to be a pentameric structure जिसमें हमारे पास होता है अल्फा बीटा गामा, alternatively arranged alpha beta gamma. So at the alpha beta यहाँ पे और at the alpha beta यहाँ पे, at these 2 points, usually there will be action of BA barbiturate. ये भी क्वेश्चन आता है, B and A अल्फा बीटा पे कौन काम करेगा? बार्बिटूरेट. और अल्फा गामा पे who will be working at the alpha gamma? So at the alpha gamma subunit, your benzodiazepine will be working. So what I say, that if I give you my Benzacar and I say that okay, go take yourself on a ride on my Benz car, तो आप बोलोगे सर अगर आपने मुझे बेंज कार अपनी दे दी तो मैं तो सड़क पे आग लगा दूंगा. देखो बारबी में बी और ए साथ साथ हैं. देयर इज नॉट मच स्ट्रगल बिकॉज बी एंड ए साथ साथ हैं. लेकिन जब एग्जाम में आएगा ना कि अल्फा बीटा अल्फा गामा बीटा, तो दिमाग वहां पे काम करना बंद कर देगा कि बीटा गामा भी तो हो सकता है, गामा तो था लेकिन अल्फा था कि नहीं था, वहां दिमाग काम नहीं करेगा. तो यू शुड बी वेरी वेरी सटल. सर ने बोला था बेंज कार देंगे तो मैं रोड पे क्या करूंगा? रोड पे बीटा गामा तो कुछ नहीं होता है, अल्फा गामा होता है, रोड पे मैं आग लगा दूंगा, है ना. बेंज कार लेके आग लगाऊंगा, बारबी को लेके आग नहीं लगाना है. बारबी में बी एंड ए है, बारबी में बी एंड ए अल्फा बीटा सब यूनिट पे काम करेगा और यही आपके एग्जाम का पोटेंशियल एमसीक्यू हो सकता है. रिमेंबर दैट. सो बीच से क्लोराइड की इनफ्लक्स होती है, सो दे आर गोइंग टू इंक्रीज द फ्रीक्वेंसी ऑफ क्लोराइड चैनल ओपनिंग. इफ यू कंपेयर द सेम barbiturate, they are going to increase the duration. Because I am discussing barbi, why not discuss the difference between these two? And we always expect one question from these two, right? Barbiturate is the GABA mimetic. They are going to increase the duration of chloride channel opening. Whatever I said is already written there, right? They are the GABA facilitator and they are going to increase the frequency of chloride channel opening. More frequent chloride channel will be opening, right? they are more safer as compared to barbiturate. Barbie is not safe, Barbie is very very unsafe, है ना. Everyone likes to be Barbie. Are you guys listening to me? आज के टाइम पे सब क्या बनना चाहते हैं? They all like to become, they all like to mimic Barbie. और आप सभी को पता है बारबी इज वेरी वेरी डेंजरस. अगर बारबी ने डस लिया, उसका एंटीडोट भी अवेलेबल नहीं है. तो बारबी है तो खूबसूरत, लेकिन बारबी बड़ी अनसेफ है. बारबी बड़ी अनसेफ है, और बारबी ने डस लिया तो बारबी का कोई भी एंटीडोट नहीं है. देयर इज नो एंटीडोट, रिमेंबर दैट. और डस लिया तो पुश्ते याद रखेंगे, मतलब सीवियर एंटीग्रेट एमनीशिया हो जाएगा. समझ रहे हैं आप लोग? हाँ, थायोपेंटोन सोडियम, फिनोबार्बिटोन. थायोपेंटोन सोडियम इज वन ऑफ द एनेस्थीसिया इंड्यूसिंग ड्रग. एनेस्थीसिया इंड्यूसिंग ड्रग, ठीक है. दे आर वेरी वेरी पोटेंट एंजाइम इंड्यूसर. दीज आर वेरी वेरी पोटेंट एंजाइम इंड्यूसर. तो मैं बारबी की बात कर रहा था ना, तो आप सबको पता ही है आपकी अपनी बारबी भी होगी, है ना. नहीं है तो इमेजिन कर लीजिए आपकी बारबी भी इंड्यूस करती है नहीं करती है ना. इंड्यूस लेकिन होना नहीं है, मैंने बताया था टू मच इंडक्शन कैन लीड टू फेलियर. इंड्यूस नहीं होना है, सख्ती के साथ रहना है, राइट. सो बारबी विल बी वेरी मच इंड्यूसर, वेरी डेंजरस. दे आर हैविंग वेरी नैरो therapeutic index. They are very unsafe kind of drug. So dose response curve इनका बहुत ही steep आता है. All right, and because they are very good enzyme inducer, remember they are going to be contraindicated in porphyria also. They are going to be contraindicated in porphyria, and they will induce the rate limiting enzyme like ALA synthase. Okay, but Benz is a very safe car. It brings lot of facility in your life. It is very very safe. No enzyme induction, no enzyme inducing property, non-addictive as compared to a Barbie. They will cause anterograde amnesia but not severe, and their antidote is also available. The one we call it as a flumazenil. The name of the right, the name is called your flumazenil, right. Flumazenil. Yes, tetra is contraindicated pregnancy and children. बिल्कुल, ये मैंने बताया ना आपको ऑलरेडी. See, contraindicated in pregnancy and pediatric less than 8 to 10 years. यहाँ पे लिखा हुआ ऑलरेडी, आपके सवाल का जवाब लिखा हुआ है यहाँ पे ऑलरेडी, ठीक है. See, there are a lot of drugs that are contraindicated in porphyria, है ना, like phenytoin है, rifampicin है, OCPs हैं, barbiturates हैं, सल्फा ड्रग्स हैं, है ना. तो मैं अपने रेगुलर क्लास में बताता हूँ एक निमोनिक करके प्रॉब्लमेटिक ड्रग्स, इनको प्रॉब्लमेटिक ड्रग बोलते हैं. सो दे आर यूजुअली अवॉइडेड. फेनिटोइन, रिफाम्पिसिन, ओसीपीस, बार्बिटुरेट एंड सल्फर ड्रग्स. ओके, तो बेंज याद रहेगा किस साइड पे काम करता है? अल्फा एंड गामा. ये कहाँ काम करेगा? अल्फा एंड बीटा सब यूनिट पे काम करेगा. ऑलराइट, नेक्स्ट ड्रग दैट आई एम गोइंग टू डिस्कस फॉर ऑल ऑफ यू गाइस इज गोइंग टू बी डाइसल्फिराम. सो सी, ऑलरेडी हम लोग डी पे ही हैं, बट जैसा कि मैंने आपको पहले ही बता दिया था कि आई ट्राई टू squeeze down maximum data as much as I can. Disulfiram, remember, it's one of the drug that is known as your aldehyde dehydrogenase inhibitor. Aldehyde dehydrogenase inhibitor. Lorazepam, oxazepam, safe in liver, yes. The shorter acting ones are safe in liver. If you're going to look at the short acting benzodiazepine, these are going to be agents like your Baba, Leto Baba, right. They are shorter acting one, that is going to be lorazepam. They are going to be estrazolam, triazolam, temazepam, oxazepam. Oxazepam is available as it is, and oxazepam is also one of the metabolite of diazepam. Diazepam always gets metabolized to form oxazepam, so they are the active metabolite of the diazepam. So these are known as your Baba Leto wale drug, Leto, Leto, Letto. So these are going to be safe in elderly and hepatic failure, safe in liver failure patient and elderly. So this was also one of the question that has been asked. ठीक है, liver failure patient and elderly with their safer drug. Disulfiram, as I was telling to all of you guys, aldehyde dehydrogenase inhibitor, and they are going to increase the level of acetaldehyde, and this acetaldehyde is always going to be associated with symptoms that is going to cause nausea, vomiting, nausea, vomiting, fall in the blood pressure, headache, flushing episode, abdominal pain, right? So these all symptom are known as disulfiram wala symptom. Disulfiram wala symptom. So in presence of disulfiram, a person should always and always avoid alcohol, because there will be accumulation of acetaldehyde and they are going to be very much toxic. Aldehyde dehydrogenase inhibitor disulfiram is mainly utilized as an aversion therapy. Please do remember, they do not decrease craving, they are mainly utilized as an aversion therapy. ये aversion therapy के लिए हम इसको utilize करते हैं. हम इसको किस लिए यूज करते हैं? aversion therapy के लिए यूज करते हैं disulfiram. Okay. There are other drugs that is causing disulfiram like reaction, and I always say that this kind of reaction you will find in Government Medical College of Madhya Pradesh and Chhattisgarh. Government Medical College of Madhya Pradesh, Chhattisgarh, like griseofulvin, examiner पूछा which antifungal drug, metronidazole which anti-amoebic drug, cefotitan, cefoperazole, cefamendol, right? They are going to be cephalosporin, moxalactam, procarbazine, an anti-cancer drug, and chlorpropamide, that is going to be first generation sulfonylurea. First generation sulfonylurea. So these are other drugs that are showing disulfiram like reaction. Okay. Yes, that is why you are not using metronidazole also with alcohol, because metronidazole, they are all having aldehyde dehydrogenase inhibiting property. So in presence of metronidazole, if the person consumes alcohol, or in presence of griseofulvin as an antifungal drug, if the person consumes an alcohol, there will be accumulation of acetaldehyde. Okay, so that is why these drugs should be avoided with the in alcoholics. No, avoided always with the alcohol. Avoided with alcohol. And next is going to be ethambutol. Ethambutol, thamjana. Ethambutol is known as your first line anti-tubercular drug. First line ATT drug, ethambutol. Thamjana matlab ruk jana. Remember, they are going to be tuberculostatic in nature. Tuberculostatic. Tuberculostatic. Tuberculostatic in nature. Ethambutol. What is the meaning of thamjana? मतलब रुक जाना. बारिश आ रही थी, थम गई, है ना. थम जाना is रुक जाना. They are going to be an arabinosyl transferase inhibitor. Arabinosyl transferase inhibitor. Please remember, this arabinosyl transferase is a very, very important enzyme that is required for the polymerization of arabinoglycans. Arabinoglycan are the constituent of the Mycobacterium cell wall, but the most important constituent is mycolic acid. Mycolic acid inhibitor are going to be cidal in nature, but this one, arabinosyl transferase inhibitor, they will lead to, there will be no polymerization of arabinoglycans. No polymerization of arabinoglycans. Remember that. So they are tuberculostatic drug. Tuberculostatic drug, that is going to be ethambutol. Tham jana matlab ruk jana. Examiner asks, what is the cause of the resistance? So the cause of the resistance is going to be EMB gene mutation. EMB gene mutation is going to be the cause of the resistance for the ethambutol. The dose of the ethambutol, that is going to be around 15 mg per kg per day. 15 mg per kg per day. Important side effect, if you are going to look at this, apart from nausea and vomiting, they are going to be associated with the optic neuritis. Ethambutol eye wala side effect. Optic neuritis leading to red-green color blindness. 2024 mid-year question. 2024 mid-year question. Red-green color blindness. Okay. So that is going to be ethambutol. Tham jana matlab ruk jana. All right. All right. HRZE. So ethambutol is one of the tuberculostatic agent. Fluoxetine. What is fluoxetine? Remember, fluoxetine is going to be one of the SSRI। सोनू, मैं आपको बता रहा हूँ, ATT वाला जो था ना, थायराइड वाला, सो TB ड्रग associated with thyroid abnormality, it is going to be ethionamide. सो इथम्बुटोल और इथियोनामाइड में अंतर है ना, इथियोनामाइड और एक का नाम है पैरा अमाइनो सैलिसिलिक, right? So this was also one of the PYQ. It's also one of the PYQ. Which TB drug is associated with thyroid abnormality, ethionamide and para amino salicylic acid? ठीक है. So SSRI is fluoxetine, and fluoxetine, it is metabolized to form norfluoxetine. Do you guys know that norfluoxetine is also one of the active compound, and it lasts for around 180 hours? So they are going to be the longest acting SSRI. SSRI, selective serotonin reuptake inhibitor. They are going to be antidepressants in nature. Antidepressant, fluoxetine, right? So we have citalopram, escitalopram, fluoxetine, fluoxamine. So they are going to be SSRI. They are going to be utilized. SSRI, they inhibit the reuptake of serotonin by inhibiting SERT, SERT transporter. किसको इनहिबिट करेंगे? SERT, SERT transporter. Okay, SERT transporter. So if this is going to be the presynaptic neuron, and here we have serotonin, so this serotonin, excess of the serotonin will be reuptaken with the help of a transporter called SERT, right? This transporter is called SERT, and SERT transporter को inhibit करके हमारा drug काम कर रहा है. Our drug is going to inhibit this SERT transporter. Okay, fluoxetine. So this SSRI, it is not only used in depression but also can be used in anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder. Multiple condition में we are using. ठीक है. And side effect of SSRI, all time favorite question, that is going to be SSRI का side effect, SSRI, SSRI का side effect, SSRI, SSRI. इससे आसान क्या होगा? सर ने बता दिया SSRI का साइड इफेक्ट कुछ नहीं, बस SSRI, as simple as that. SSRI का साइड इफेक्ट SSRI. So how will you remember this SSRI का साइड इफेक्ट SSRI? Serotonin syndrome, sexual dysfunction, restlessness, insomnia. Under serotonin syndrome, remember we have nausea, vomiting, dizziness, है ना, BP fluctuation, agitation, रंगीन सपने आना, vivid dreams. In the 2024, examiner asked, what is the drug of choice? How will you manage? So the drug of choice for this one is going to be cyproheptadine, one of the anti-serotonergic drug. Cyproheptadine is one of the anti-serotonergic drug having antihistaminic property. Off label, it is also used as an appetite stimulant, and as an appetite stimulant also it is used. ठीक है. Sexual dysfunction सबसे ज्यादा डेपोक्सिटीन करता है. तो दो तरह के सेक्सुअल डिस्फंक्शन करता है, एक हैप्पी और एक अनहैप्पी. हैप्पी वाला ये है कि दे आर गोइंग टू कॉज डिलेड इजैकुलेशन, तो आपको हैप्पीनेस मिलेगा, आपको मतलब अगर आपको प्रीमेच्योर इजैकुलेशन है तो. अनहैप्पी साइड इफेक्ट ये है कि दे आर गोइंग टू कॉज एनोर्गेज्मिया एंड डिक्रीज इन लिबिडो. लो, खत्म, टाटा बाय बाय, है ना. एनोर्गेज्मिया, डिक्रीज इन लिबिडो, है ना. लिबिडो ही नहीं आएगा, और आ भी गया तो ऑर्गेज्म तक नहीं पहुंच पाओगे, एनऑर्गेज्मिया रहेगा, राइट. सो ये अनहैप्पी हो गया. हैप्पी इसलिए बिकॉज दे आर गोइंग टू बी FDA अप्रूव्ड ड्रग फॉर प्रीमैच्योर इजैकुलेशन, है ना. डेपोक्सिटीन इज अ डेरिवेटिव ऑफ पैरोक्सिटीन, है ना. दिस सेक्सुअल डिसफंक्शन इज मैक्सिमली विद पैरोक्सिटीन, मैक्सिमली विद द पैरोक्सिटीन. ठीक है. तो SSRI के साइड इफेक्ट इज गोइंग टू बी SSRI, है ना. एक दो और ड्रग, ऑल्दो हमने 10 से ज्यादा ड्रग तो डिस्कस कर लिए, लेकिन एक दो और ड्रग बता दे रहे. गैनसाइक्लोविर, गैनसाइक्लोविर, दैट इज वन ऑफ द DNA polymerase inhibitor. गैनसाइक्लोविर, an antiviral drug, antiviral drug. It is considered the drug of choice of CMV. We can also utilize them in other condition as well. CMV, like CMV retinitis. Always remember CMV retinitis में ये जो आपको पिज्जा पाई रेटिनोपैथी देखने के लिए मिलता है, पिज्जा पाई रेटिनोपैथी, है ना. पिज्जा पाई रेटिनोपैथी always going to be associated with your history of HIV, and also in CMV anogenital warts. CMV, anogenital warts may be also they are the drug of choice, right? So you can see this one, a case of anal area, anogenital warts वाला जो area है, right? So इसमें भी they are considered the drug of choice, okay? Cytomegalovirus. We can have multiple other uses, but as of now, just remember this one. Because fluoxetine has मैक्सिमम हाफ लाइफ 180 घंटा है ना, इसीलिए उसका लेस रिस्क ऑफ विड्रॉल सिंड्रोम होता है, ठीक है। नाउ दिस वन इज herpes keratitis. Please do not be confused with this one and the previous image. Herpes keratitis is going to be, इसका ड्रग ऑफ चॉइस होगा दैट इज गोइंग टू बी एसाइक्लोविर। तो ये जो ग्रीन वाला ये वाला जो इमेज है राइट हैंड साइड पे, जिसमें आपको ये इमेज जो दिखता है राइट, हर्पीस केराटाइटिस का, इसको हम बोलते हैं डेंड्रिटिक लीजन। और अगर यही इसी का एरिया बढ़ जाता है सीवियर कंडीशन में, इसी को ज्योग्राफिकल अल्सर भी बोलते हैं, है ना, उसके लिए ड्रग ऑफ चॉइस एसाइक्लोविर होता है। लास्ट ड्रग आई थिंक मैं आपको डिस्कस कर सकता हूँ, दैट इज गोइंग टू बी लिथियम। लिथियम इज ऑल्सो वन ऑफ द ड्रग दैट इज वेरी फ्रिक्वेंटली आस्क्ड नाउअडेज। इट्स अ ड्रग ऑफ चॉइस फॉर मैनिया, बट प्लीज रिमेंबर इट हैज नो यूज इन एपिलेप्सी। तो एग्जाम में क्वेश्चन पूछा व्हाट इज द ड्रग दैट इज गोइंग टू बी यूज्ड इन मैनिया, सबसे पहले स्टूडेंट मार्क लिथियम, बट the next line, the complete question says the drug that is going to be used in mania and is also effective in epilepsy, उस कंडीशन में सबसे पहले जो ड्रग रूल आउट होगा वो आपका यही ड्रग होगा, लिथियम रूल आउट होगा। तो उसमें जो क्वेश्चन आया था ड्रग यूज्ड इन मैनिया एंड इफेक्टिव आल्सो इन एपिलेप्सी, उसका जो आंसर था दैट इज गोइंग टू बी कार्बामाजेपिन। अपकमिंग एग्जामिनेशन में ऑप्शन चेंज करेगा, so there can be carbamazepine, topiramate can be used in mania, have anti-epileptic property, topiramate and also valproate, ठीक है, valproate। so not only valproate but others भी हैं, है ना, valproate, carbamazepine and topiramate, these are the other anti-epileptic drug having mood stabilizing property, ठीक है। lithium is always going to be avoided in pregnancy, तो pregnancy में we always used atypical antipsychotics, and the side effect of lithium you can remember by the simple mnemonic of LITH, LITTH। lithium का side effect is going to be LITH, lithium का side effect LITH, ठीक है। so leukocytosis, diabetes insipidus, tremor is always going to be a very common side effect. Initially there will be fine tremor followed by coarse tremor. It will be teratogenic drug that will be leading to Epstein anomaly. Epstein anomaly को अगर आप एक्सरे पे देखोगे तो आपको बॉक्स शेप हार्ट मिलेगा, which I always say remember like this, Epstein टिन से बनता है बॉक्स। हाइपोथायरॉयडिज्म, so lithium का साइड इफेक्ट is going to be LITTH, leukocytosis, diabetes insipidus, tremor, teratogenic drug and hypothyroidism, right, hypothyroidism। एंड लिथियम का एक और जो सबसे इंपॉर्टेंट चीज रहता है दैट इज गोइंग टू बी देयर प्लाज्मा। सी इन मल्टीपल बुक्स सम प्लेसेस में दे हैव गिवन अप टू 1.2, है ना, बट इन स्टैंडर्ड टेक्स्ट बुक इट सेज 0.6 to 1.5 मिली इक्विवेलेंट इज अ थेराप्यूटिक। सो इन थेराप्यूटिक में वी हैव prophylaxis also, acute also। prophylaxis में the level should be 0.6 to 1 and 1 to 1.5 is going to be acute manic condition। beyond 1.5 considered toxic, right, beyond 1.5 considered toxic। and पूछा death, तो beyond 4.2 death can be possible। the best treatment for this is going to be dialysis। dialysis is going to be the best treatment option for lithium over to lithium toxicity, all right। lithium toxicity में initially the patient will have GI followed by CNS symptom like muscle weakness, irritability, apathic। later on there will be delirium and tremor, other CNS symptom will be coming like slurring of speech, confusion, drowsiness। in severe toxicity that is beyond 2.5 we will be getting cardiac involvement where there will be QT prolongation, flat T wave। renal में distal tubular acidosis, patient will also have seizure and death। so these are going to be the important toxic manifestation of lithium. Lithium का overdose में we take, always remember, dialysis. Lithium, because they are having narrow therapeutic index, we always require therapeutic drug monitoring. This is very very important. और उसी पॉइंट पे मैं नेक्स्ट आ रहा था निको कि थेराप्यूटिक ड्रग मॉनिटरिंग तो हम करते हैं. इट इज गोइंग टू बी स्टार्टेड at least 7 to 10 day after lithium therapy. ऐसा नहीं कि आज लिथियम स्टार्ट किया कल से आपने स्टार्ट कर दिया लिथियम का मॉनिटरिंग. And the sample that you are going to collect, sample is going to be collected 12 hours after the last dose. 12 hours after the last dose, right? This is the time it will take to reach to the trough plasma concentration. ठीक है. आई थिंक एक और रह गया फेनिटोइन. जब फेनिटोइन है तो एक और ड्रग होगा, तो दैट मीन दो दवाइयां और रह गई हैं. फेनिटोइन, रिमेंबर, इट्स वन ऑफ द oldest non-sedative anti-epileptic drug, but this anti-epileptic drug is also having very potent enzyme induction property, है ना. They are actually following zero order kinetics, but in the plasma concentration 10 to 20 they follow first order kinetics. Beyond 20 they start following zero order kinetics. So this is going to be an example of a drug that is following zero order kinetics. Phenytoin, apart from different epilepsies, we also use them as an antiarrhythmic drug, that is class 1B antiarrhythmic drug, class 1B antiarrhythmic drug, and they also enhance the wound healing. So which anti-epileptic drug has a wound healing property? If you see this question, please do not be confused. Put a smile on your face and mark which anti-epileptic drug have antiarrhythmic property, that is phenytoin, right? So they can be utilized in seizure, neuropathic pain, plus non-epileptic uses are going to be neuropathic pain, antiarrhythmic drug, and enhances the wound healing. Important side effect, remember, because of their enzyme inducing property, they will always lead to a lot of drug interaction, leading to treatment failure, hirsutism, hyperglycemia. So diabetic, you should be very very careful. Enlarged gum, that is gum hypertrophy, being the most common side effect. And this was asked in अभी जनवरी में ये क्वेश्चन पूछा हुआ था. In January itself this question was asked कि a patient was given an anti-epileptic drug and now he is presenting with the gum bleeding या gum hypertrophy, and so which of the following anti-epileptic drug could have caused this gum hypertrophy? So this gum hypertrophy that has been shown in the image is going to be associated with this. They are also causing nystagmus, yellow brown skin, tachycardia, especially with the phosphenytoin, which is a water soluble prodrug, and they are also going to be associated with the neurotoxicity. Osteomalacia, increasing the risk of fracture. They interfere with the B12 and folate absorption, therefore there will be megaloblastic anemia. Because of the B12 deficiency, there will be neuropathy also, that can lead to decrease in the deep tendon reflexes, right? They will also be leading to fetal hydantoin syndrome, that is a teratogenic effect. So phenytoin ka side effect also you can remember by the simple mnemonic of phenytoin, right? Yes, that is why they are causing hyperglycemia, because they decrease the insulin secretion. So phenytoin ka side effect is phenytoin, P450 interaction, HCA, hirsutism, hyperglycemia, enlarged gum hypertrophy, right? Nystagmus, yellow brown skin, that is the early kind of side effect, and tachycardia, especially with the phosphenytoin, osteomalacia, that is increasing the risk of fracture, interfering with the B12 and folate absorption, and neuropathies. Plus fetal hydantoin syndrome, that all of you guys are already aware. The patient will, or the baby will have cleft lip and palate, microcephaly, thin upper lip, short phalanges, everything will be very very small in fetal hydantoin syndrome. Valproate is the last drug I promise. Valproate is one of the voltage gated sodium channel blocker, decreasing the glutamate release. There are also T-type calcium channel blocker at the thalamus. So the central area of abnormal firing is going to be controlled, increasing the GABA activity by inhibiting GABA transaminase. So they have GABA transaminase inhibiting property, and they also have succinic semi-aldehyde dehydrogenase inhibiting property. दोनों को inhibit करके काम करता है. This drug is the only one that is going to have an important एंजाइम इनहिबिटिंग प्रॉपर्टी। पर्पल ग्लव सिंड्रोम, यस, फेनिटोइन के साथ होता है पर्पल ग्लव सिंड्रोम ऑल्सो, राइट। येलो ब्राउन स्किन एक्जेंथेमस पस्ट्यूल ऑस्टियोमलेशिया, तो इसमें नहीं है, एक और लिख लीजिएगा यहाँ पे, पर्पल ग्लव सिंड्रोम, because of the crystal, the drug will be crystallized and they will be lodged into the distal arteries, leading to, you know, discoloration of the digits, causing purple glove syndrome. They are the enzyme inhibitor. Valproate is a very potent enzyme inhibitor. Remember, only anti-epileptic drug having enzyme inhibiting property. Okay, they are the very, very potent enzyme inhibitor. Utilized as a drug of choice in many condition. GTCS में यूज कर सकते हैं, but the drug of choice for GTCS is known as your lamotrigine. This is also one of the first line drug that can be utilized in condition like Dravet syndrome, Lennox-Gastaut syndrome, myoclonic seizure. In सब में it is the drug of choice. Rapid cycler में also it's the drug of choice. Rapid cycler in bipolar disorder, any patient having mania and depression, 4 cycle, right, उसको बोलते हैं rapid cycler. Other non-epileptic uses are going to be your prophylaxis of migraine, that is the non-epileptic use. Rapid cycler, that is going to be the non-epileptic use. Sydenham chorea is going to be the non-epileptic use. The therapeutic plasma concentration of valproate is going to be 50 to 100 microgram. Valproate is 50 to 100. Remember, phenytoin I told you 10 to 20. An important side effect of valproate is mainly going to be your hepatotoxicity. That is very, very important side effect. Hepatotoxicity and pancreatotoxicity. Weight gain, tremor, alopecia. These are the important side effects. Remember that with respect to valproate. It's the most teratogenic anti-epileptic drug. It is the most teratogenic anti-epileptic drug associated with your spina bifida. Spina bifida. Okay. So PCOS is there, yes, it's a gender specific side effect that we know, right? So this is everything about top 10 drug. Actually 10 drug तो था कहने के लिए, लेकिन मैंने more than 15 to 20 drugs आपके लिए डिस्कस किया। अगर आपने ध्यान दिया है तो समय थोड़ा सा लग गया, बट आई एम श्योर कि लास्ट में रिवीजन, पैसिव रिवीजन ही बहुत ज़्यादा काम आता है। तो जितनी इन्फॉर्मेशन मैंने आपको स्क्वीज डाउन करके दी है, आधे घंटे का सेशन था, बट आई थिंक वी रफली हैव टेकन 1 hour. That should help you out. Tomorrow I'll be taking another session for all the students. Remember, yes, L-carnitine for valproate toxicity. Treatment of toxicity, L-carnitine. ठीक है, that is correct. Dr. Medico's channel. ठीक है, that is correct. So tomorrow is going to be the beginning of Mission FMG June 2025, where every day minimum of 2 and maximum of 3 subject will be taken. So आपके ऊपर ओवर बर्डन नहीं रहेगा। 1 हफ्ते का प्रोग्राम है, पूरी तरह से चीज़ों को आप यहाँ पे आकर के छोड़ सकते हैं और यहाँ पे आकर के रिवाइज कर सकते हैं। बाकी चीज़ों को फॉर टाइम बिंग यू कैन लीव एंड यू कैन रिवाइज हियर, बिकॉज जितने प्रीवियस ईयर टॉपिक्स हैं उन सभी को यहाँ पे सारे टीचर्स अपने अपने वर्कबुक के साथ आएंगे और फटाफट खत्म करते हुए जाएंगे। छोटे सब्जेक्ट 2 घंटे में, बड़े सब्जेक्ट 3 से 4 घंटे में। जो मेडिसिन सर्जरी टाइप सब्जेक्ट है, मान लीजिए 5-5.5 घंटा या 6 घंटे भी लग सकते हैं, राइट। तो आई होप ऑल ऑफ यू गाइज हैव enjoyed this session, and tomorrow we are going to start the Mission FMG. I will be taking the first class tomorrow at 11 a.m. I hope to see you all. Thank you very much to all of you guys. Enjoy your evening. See you guys tomorrow and in other upcoming classes. अगर आप लोगों को कोई क्वेरी है तो बताइए। हमारे टेलीग्राम मेंबर्स जो टेलीग्राम से जुड़े हुए हैं और कुछ कहना चाहते हैं। Yes, anything you guys want to say? कोई परेशानी, कोई दुख है? यूजुअली दुख आपका पीछा छोड़ेगा नहीं जब तक आप एग्जाम में अच्छे से करोगे नहीं, है ना। आप बोलते रहो ये दुख पीछा काहे नहीं छोड़ता, दुख छोड़ेगा नहीं, क्योंकि आप दुख से दोस्ती नहीं कर रहे हो। दुख को अपना बनाओ, उसके साथ बॉन्डिंग करना सीखो, है ना। एक बार उसको लग जाएगा कि हाँ भाई ये तो अब डरना बंद कर दिया, दुख अपने आप दूर हो जाएगा। ठीक है, यस ठीक है, आई विल बी टेकिंग 2021 का सेशन, यस दैट इज देयर, आई विल बी टेकिंग दैट आल्सो एज सून एज पॉसिबल, मे बी कल तो नहीं, मोस्ट लाइकली परसों मैं वो सेशन ले लूंगा, ठीक है। चलिए बाय बाय टू ऑल ऑफ यू गाइस, हैव अ गुड नाइट, एंजॉय योर इवनिंग, ऑल माय टेलीग्राम स्टूडेंट, यूट्यूब स्टूडेंट्स, जहां से भी आप देख रहे हो, हैव अ गुड नाइट।